Spruce RN is a website designed by nurses for nurses that we launched earlier this year. Our goal is to provide a one-stop shop location to support rural remote nursing education that is hands-on, engaging, budget-friendly, and accessible. Any nurse across Ontario can access one of our several modules and gain the knowledge necessary to build, design, and implement hands-on education at their centers. We consulted with our virtual critical care network and fellow simulation champions across Northern Ontario to determine what content would best suit their needs. With this information and feedback, we developed a website with modules that include IV insertion, IO insertion, suturing and stapling, CPR, wound care, and more. We also have a whole section on rural remote considerations like shipping and ordering, seeking volunteerism, and how to determine if DIY is the best option for you.
Having worked as an outpost nurse in Quechua First Nation and Holly's experience in crisis services, we believe this website makes an impact for remote nurses. This is just the beginning, with more modules and sections to come. We're incredibly grateful to the Registered Nurses Foundation of Ontario, who funded and saw the potential for this website, and for our review nursing team, Megan, Jacob, Laura, Siobhan, and Adele, our prototype designer and SimTech extraordinaire, Sebastian, and our website designer, Joseph, who all played an important role to make this happen. We've been able to support our colleagues in Waha, Timmins, Temiskaming area, Parry Sound, Manitoulin, Espanola, Sturgeon Falls, and more, helping to save travel costs and logistical considerations. Having quality nursing, simulation, and education that reaches widely benefits everyone, especially for those at the beginning of their journey. We see that here, and we see that with one of our newest in-person programs, the Novice Nurse Workshop.
The Novice Nurse Workshop was developed by a team of experienced nurses, including myself, Joanne Collin, Renee Fillier, and Holly Sarvis, to support our new nurses in their transition to practice. Recognizing the limitations on hospital placements throughout the pandemic, we consulted with novice staff and listened to what they were struggling with on the units and developed the content for the two-day workshop. The workshop takes place at the Simulation Lab and combines high-fidelity simulations along with classroom learning and tabletop case-based learning. Our experienced nurses and nurse clinicians review best practices in assessment skills, end-of-life care for patients and their families, tools for communicating with patients, families, and within the interprofessional team, as well as prioritization and escalation of care. We have also integrated interprofessional learning by having a medical resident attend for the learners to practice their communication skills in situations where they would need help and have to escalate care of the patient. Our goal with this is to help break down any barriers and provide feedback on their communication in high-stress situations so they can effectively advocate for their patients' needs at the bedside. We feel incredibly privileged to provide this education to our new nurses and to be able to provide them a safe, supportive environment to build their abilities and their confidence as they transition to independent practice. We are proud of this workshop and what it has provided our new staff, and learner feedback has been very positive, and that we are helping to bridge knowledge gaps and build their skill sets.